Don't worry, you guys. I'm not back this week with another spiritual healer that's going to tell you to rub dirt in their face. Instead, we have another sciencey episode for you all about the root causes of autoimmune disease. But of course, there is a spiritual twist because we're going to talk a lot about trauma and the underlying nervous system activation that can lead to immune overactivation. So of course, we are going to hit this in the most holistic sense possible. Today's guest is Dr. Sara Gottfried. We've had her on the podcast before to talk about PCOS, and today she is doing a deep dive with us on autoimmunity. She is one of the most well-known, well-read, well-written functional MDs in the holistic health world. And she is going to give us the full breakdown on why Western medicine is really failing us when it comes to identifying and treating autoimmune disease. We're going to chat about why it can take 7 to 14 years for autoimmune diseases to even show up on a lab panel and be detected, and why we're failing people with autoimmunity during these crucial years where they can actually take steps to remedy and reverse the root causes, what you can do if you're going down the road of autoimmunity, and of course, what you can do if you're already there to actually address those root causes. We're going to chat about why no matter what autoimmune disease you have, those root causes are exactly the same, and there is something that you can do for each and every one, especially when it comes to your gut health. And we're going to really deep dive, like I said, into this concept of trauma as a catalyst event for the cascade of immune dysregulation. In Sarah's new book, she actually says, quote, autoimmunity may be the ultimate expression of trauma. And we're going to talk about why this affects women at disproportionate rates compared to men. Sarah's paradigm in terms of not only exploring, but also truly addressing autoimmunity in the long term and how she believes you can heal is so refreshing and so needed in today's world. And I hope that it is how all doctors of the future will see this very complex inflammatory disease, and will especially see the whole person behind it who is experiencing this disease, who has a history of trauma and nervous system dysregulation and just needs to be witnessed and validated and supported. I was so fascinated listening to her speak, and I love what she advocates for. She talks about psychedelic medicine. She talks about getting into a healing state of consciousness. She talks about orgasmic meditation. Like, she is so not afraid to think outside of the box as a doctor and tap into all these different practices that can create a sense of safety within your body and your nervous system in order to quite literally treat autoimmune disease. And it's the kind of solutions and messaging that we need, because we're not getting many answers in the conventional medical world outside of medication management. So I hope this episode gives you hope. I hope it teaches you something new, and I hope that you enjoy it as much as I enjoyed recording it for you. As always, thank you so much for being on this ride with me. Thanks for sharing this hour with me every week and just being along for the journey. I appreciate you so much, and I will see you next week. Welcome to the show.
How are you going to grow if you don't know where you're growing from?
Whoa.
This is the scientific proof of grace.
That's wild.
What is healthy to you?
I've just moved toward liberation. Let's get juicy. I'm so honored to have you back on the show for a second time, and now in person we get to connect, which is so exciting.
Oh, Olivia, I'm so happy to be here.
I love that your newest book is about autoimmune disease, because it is exploding, and I'm sure that's why you've written it, because so many folks are out there looking for help. So I'd love to start off today by getting right into the definition of autoimmunity. What's happening to the body when we're in this state, and what are the different presentations that one may experience?
Well, there's such a spectrum in terms of autoimmunity. On one side is totally normal immune function, and that's where you get your white blood cells, your immune system is traveling through your bloodstream. It knows the difference between your normal tissues and tissues from the outside, or like, a bacteria that doesn't belong there, or a virus, and it attacks it. On the other end is autoimmune disease. And there's over 100 of those. That includes rheumatoid arthritis, Hashimoto's thyroiditis, multiple sclerosis, type 1 diabetes, psoriasis, lots of different diseases.
Yeah.
And then there's this whole middle ground between the two. And that's where you start to lose your tolerance. Your immune system starts to have difficulty separating your sense of what is your self tissues and what it starts to react to an attack. So you lose this ability to separate self from non-self, and it leads to an attack of your thyroid in Hashimoto's thyroiditis. It leads to multiple sclerosis, an attack of the myelin that helps your nerve cells have quick transmission. As you go through this process of autoimmunity, you can detect some of these early signs in laboratory testing 7 to 14 years before you can actually make a diagnosis of autoimmune disease. And we know that a lot of people have these mysterious symptoms that they struggle with for 4 to 7 years before they make a correct diagnosis with their clinician. And they might even see 4 to 6 doctors before they've got that accurate diagnosis.
I actually have a follow-up to that. I've heard before that it can take 7 to 14 years, perhaps even more, before you even get a positive ANA or a positive TPO antibody in your lab work. Why does it take so long for antibodies to be measured, even when autoimmunity is present, that period of time before it becomes a diagnosable disease with an antibody on a lab test? And what are some of those labs that you just mentioned that we can look at in that in-between phase to see the early detection?
The main reason that we're not measuring it is that we're not measuring it. So I think every patient that I see, I run an autoimmune panel on. So I'm looking at thyroid peroxidase antibodies. I'm looking at anti-nuclear antibodies. I'm looking at rheumatoid factor. And so not everyone is getting that kind of screening test. In fact, I would say most are not, because the typical thing in allopathic conventional medicine is that you come in with a constellation of symptoms. You've got joint pain, you've got fatigue, you've got, a constellation that looks like rheumatoid arthritis, and then you get the rheumatoid factor measured. So we've got a sequence that leads to this middle ground of pre-autoimmune disease often not being detected. And in terms of some of the other labs that I think are helpful, we're looking for inflammation, because when the immune system is overactivated, it can be inflamed. We're looking for the balance of, say, omega-6s and omega-3s in the body. We're looking at measures of the immune system. And some of these haven't changed for 50 plus years, but we can look at things like your white blood cell count. We can then separate it into your neutrophils and your lymphocytes. There's the ESR, the erythrocyte sedimentation rate. There's high sensitivity C-reactive protein. And then there's the more specific antibodies that you can measure, kind of depending on the condition.
I think that's so helpful, because if someone out there is struggling with those mystery symptoms that could be autoimmunity but are a bit more vague, they can take these labs from your book, things like CRP and ESR and that ratio, and perhaps even be the advocate for themselves that takes those to their doctor and says, hey, I want to measure these. Something's not right and I feel like something's off. Can we just look at a little bit of a deeper lab panel?
For sure. And don't be dismissed. Don't let your clinician dismiss you about it, because this idea that someone is trying for 4 to 7 years to get a correct diagnosis, we are utterly failing those people. And so, yes, we need a top-down change. We need to change the way clinicians approach autoimmune disease, but we also need a bottom-up change. And we need for our army of listeners and viewers and followers to say, oh, no. Don't dismiss me about this. I know there's something significant here, and I want to do some blood testing to see what's going on.
Yep. My goal is for every woman listening, every human listening, to be able to walk into their doctor's office and say, TSH is not enough. I want a full thyroid panel. I want to see my TPO antibodies or both of my thyroid antibodies. I need to know, because what's the point of screening a thyroid and just looking at TSH when you could have such a fuller picture and possibly catch something that could save you years of pain?
Absolutely.
I know there are so many folks listening who have Hashimoto's thyroiditis or lupus and are feeling a bit lost and confused and perhaps at war with their bodies, because it seems to be this counterintuitive thing. Why would our cells want to attack our own tissues? And so I want to ask you, what is the process of why the body might start going into this cycle of attacking itself? Because I'm of the mindset that our bodies are always trying to work for us, not against us. And so how would it sort of help the body to be in an autoimmune state?
It's like a civil war in the body. And you would think, okay, with the wisdom of the body, why would there ever be a civil war? Of course, my immune system is going to want to support me at all costs. The problem is the immune system has never been exposed to the number of things that it's now exposed to. And if you look at some of the different drivers of autoimmune disease, there's a 3-legged stool. that's required. And this is the work of Alessio Fasano at Massachusetts General Hospital. He's a gastroenterologist. And he's found that you have to have a genetic predisposition. You then need to have increased intestinal permeability, so-called leaky gut. And then third, you need some kind of trigger. So that trigger could be that you have a traumatic experience, small t or big T. It could be that there's some other toxic stress that you're going through. It could be an infection. It could be a COVID infection. We know that long COVID has autoimmune aspects to it. It could be that you're exposed to too much glyphosate. So there's lots of different triggers that can get your body to turn against itself. On a more spiritual level, your body is meant to be in homeostasis, which is what I think you're referring to. It's meant to be in a state of balance. And when we come out of balance, when we get dysregulated, that is a message, like a divine message from the body that something is not quite right. Something needs to be addressed. So these divine messages show up in different ways. They can show up with orthostatic hypotension, with difficulty when you stand up and feeling like you're going to pass out. It can show up as an attack of your thyroid gland and Hashimoto's thyroiditis. It can show up as multiple sclerosis and maybe double vision in your eyes. So the body starts to attack itself because the network of the body, especially the parts that are most sensitive, which I call the pine network, becomes dysregulated. And so in this case, if you think of the pine network, psychoimmunoneuroendocrine network, the immune system is dysregulated. And remember, 70% of the immune system is in your gut. So a lot of this starts with food. So often we're eating foods that are triggering the immune system over and over again and lead us to develop food intolerances, food reactions, making the immune system become haywire, and leading to problems with gluten, problems with a reaction to dairy. Maybe you develop a problem with peanuts or with shellfish. So that is kind of pulling things together. There's all these different levers that are involved in autoimmune disease. And I think about the food piece first.
I like that you're bringing it back to the food and the gut health piece, because that's an area where we have a lot of autonomy and control and can be empowered. And it sounds to me when you talk about that three-legged stool analogy that perhaps 500 years ago, let's say, a lot of us may have had the genetic component and a lot of us probably had the stress component. Life's never been easy, especially not 500 years ago. But because the gut health piece wasn't as compromised, because there was not this ubiquitous presence of glyphosate in our environment, we weren't as vulnerable on the gut health side. And another guest from this season, Dr. Alexis Jasmine Cohen, who we love, came on to talk about the gut microbiome and gut inflammation. And she said that gut inflammation begets gut inflammation.
That's right.
It becomes this vicious cycle. And so until you sort of at least temporarily remove some of the offenders or figure out the change that your body needs to tamp down that inflammation, you will be in this vicious cycle no matter what else you do, no matter what other supplements you're doing or meditations you're doing. You have to address the gut.
I like how you're, hypothesizing that with the three-legged stool, there's some things that haven't changed, like our genetics haven't changed. Our epigenetics have changed, certainly. And I think our exposure to trauma is at an all-time high. I also think that when it comes to stress exposure, that we have more than ever before.
I feel like stress is relative for sure. Yes, we have different types of stress now. But the one thing that I can hypothesize may be different is that we had more of a sense of community and we had a less abstract existence almost. Now we have this abstract existence where an email does feel like the most important thing in the world, or our priorities of hitting a deadline, or we think that these many things that are calling for our attention are vastly important and our nervous system interprets them as such, whereas life perhaps used to be a bit simpler when we had others to rely on, we were in community, and we didn't have such abstract goals of human life.
I agree with that. We've lost our perspective in a lot of ways. And if I put my scientist hat on briefly, we know that this is well demonstrated in the literature. So when we look at, for instance, people's sense of loneliness, it's at an all-time high. And I think that was less likely 100, 200 years ago. I mean, my great-grandmother was born in 1900, and she just didn't struggle with some of these things that we're talking about. In her era, like an apple was a cute little tart apple. She ate whole foods because that's the only food that was available. She was deeply immersed in a community, and that was always a big part of her life. She practiced yoga, she did all these things. And I think we've lost a lot of that. And I think that is part of this loss of tolerance that can occur before the development of autoimmunity.
When you say loss of tolerance, and you referred to this concept earlier of this confusion within the body between what is self and what is other, which is what I often hear experts say when they talk about autoimmune disease. One of my teachers in herb school, Richard Mandelbaum, used to talk about autoimmunity in the context of these leaky boundaries, to where leaky gut was not just happening in the gut. There was also this leak in who am I and who are you? So not only were our gut boundaries affected physically, but our boundaries between other humans and our relationship to the world, to our food, to everything was also skewed and dysfunctional and compromised. And he would always say that correcting the relationship and the boundaries between us and the world was equally as important as correcting the physical gut boundary. How do you feel about that?
I agree with that. Again, I always sort of think about these things from a science perspective. It makes sense to me because I think that it probably also maps to how sensitive you are. So I think for folks who have really strong boundaries and they're somewhat rigid about them, but they describe them, defend them, maintain their boundaries at all costs, they only eat certain foods, like those folks often have a set of alignment about their boundaries. So here we're talking about the gut barrier, and I would also probably throw in the blood-brain barrier too. And then this barrier, this set of boundaries with other people. When I think about sensitivity, if I overlay that on this map that we're coming up with, when you're highly sensitive and you're so attuned to the boundaries of others, I think there is a physiological component to that because you're more likely to be overstimulated. You're more likely to become dysregulated. As someone who's highly sensitive, I don't see it as a problem. I just see it as, okay, I'm not like a dandelion, like 80% of the population who can just go through life and isn't sensitive. I'm in this 20% group that's highly sensitive. My boundaries are something I have to be really careful about. And I have to manage my environment because I'm like an orchid. Like I need the right light, I need the right water, I need to be directed toward the north. And when I'm given the right environment, I bloom and bloom and bloom and bloom. And we want to kind of capture that magic. So sensitivity, how does that land with you?
I think that the people listening to this show who are going to click on this episode about autoimmunity are that 20% of folks, and that's who I really speak to in terms of my community. We are the highly sensitive ones, the chronically ill ones that have this thirst for health information and knowledge because we know that our bodies and our minds don't function the way that other people's do. And we know that we can't, go to the club on a Friday night and deal with the loud music. And we've always thought something's wrong with us because that will dysregulate us for the rest of the weekend. But we've come to embrace that sensitivity also gives us immense talent and creativity and empathy. And
it's a gift.
Such a gift, but it comes with a set of rules for living in a sensitive body.
Yes, it does. Yes.
And I think of your grandmother example about how, your grandmother was like this tough woman who ate whole real foods. And I think a lot of that generation in general were these stronger boundaried people that just kind of like went through life in this way because they had to, and also because they had a stronger sense of community. And so they had more practice upholding those boundaries. And perhaps now because we've gotten away from community, that's where we're confused of like, who am I in relationship to other? Who is my community? And perhaps we don't have as much practice upholding those boundaries. And maybe that's contributing to our sensitivity. I don't know.
I think there's something to it when you recognize the sensitivity about yourself and you start to read the manual on how it is you're supposed to architect your life and your environment. Community is a huge part of that. It's no longer the case that, as you said, you can go to the club on a Friday night and just kind of be with whoever. Like, how fun is that? But then there's the cost, for like the entire weekend. Similarly, with your community, you want to be surrounded by people who have an appreciation of the way that you interact with the world, who have a way of even seeing it as a gift and like an incredible enrichment in their life. I would say it's one of many factors that highly sensitive people need to manage.
I want to bring it back to autoimmune disease as a concept and talk more about these root causes so that our audience can understand sort of the steps they can start to take. And I want to ask first and foremost, do you see all of the different forms of autoimmune disease, even though they have different presentations, can they be traced back to sort of these same root causes? Or are we looking at each autoimmune condition that affects each organ as having a different root cause?
So the way that I see it is the way that Alessio Fasano describes it, which is every autoimmune disease that he's looked at has those three root causes. So genetic predisposition, increased intestinal permeability, and then a trigger. So the trigger is what changes. And I think it also depends on where's your vulnerability. If you look at, for instance, the rates of MS after the pandemic, they have skyrocketed. And so some people have a vulnerability in their nervous system that gets their body to then attack the myelin, the part of the nervous system that insulates your nerves. So yes, there's 100 plus different autoimmune diseases. There are different triggers for each one, but the three-legged stool is true for every autoimmune disease that's been studied.
I think it's an important point to make because it can get so confusing when it comes to even people seeking treatment and trying to find the right practitioner, because in the Western medical model, you get sent to specialists who see one part of the body in a silo.
Yes.
And if you have Hashimoto's thyroiditis, you're maybe going to an endocrinologist. Or if you have rheumatoid arthritis, you're going to a rheumatologist. But the way that my teachers in herb school would say it is that regardless of if you have an autoimmune disease of the thyroid or an autoimmune disease of the joints, it's not actually a disease of the thyroid, it's still a disease of the immune system at the end of the day. The root causes that are contributing to this psychoneuroimmune endocrine balance being thrown off are still what need to be addressed, not just that organ.
That's right.
And so it seems like what you're saying is, obviously your book is very much about trauma and about finding this safety in the nervous system as the truest or most tangible path forward for all folks with autoimmune disease. And it makes sense that we don't have to overcomplicate it by the organ, that we just need to look at what was the thing that kind of set me off into interacting with the world in a different way, in a dysfunctional way.
Yeah, it might be helpful to bring in a case here because this can sound somewhat abstract. One woman in particular that this reminds me of is a woman who was in her early 40s, married. She thought happily married. And I met her at a yoga class in the Bay Area. And she reached out to me a few years later and said, I've got this terrible joint pain and I'm trying to understand, what do I do? Do I go to a rheumatologist? Is there something I can do? She knew I did functional and precision medicine. And so I started working with her and we went back and kind of peeled the onion and saw she had this terrible betrayal. So in her early 40s, she discovered that her partner was having an affair with her best friend. And so it was this devastating experience for her. And she developed symptoms of rheumatoid arthritis. So she had really painful elbows. One elbow was worse than the other. She had this, it felt like it was kind of catching. It felt like there was something gritty in there. And her primary care doctor ordered a rheumatoid factor, which is your immune system making antibodies called rheumatoid factor. So she had really high rheumatoid factor. She then had to wait a long time to go see a rheumatologist. She had private insurance, but it took like 6 months. And so that's the time where we started working together. We started working on her food. We did gut rehab. We were working on this trauma that she experienced. She was doing a lot of plant medicine. She was working with immunomodulators. And by the time she went to see the rheumatologist, she had an ultrasound that showed that her joints were relatively normal and she no longer met criteria. And this rheumatologist was saying, well, that's great, but what we do for RA is we give you immunosuppression. Do you want the prescription or not? I often see this, like this is the pattern that I kept seeing in my patients, that they would come in with what is presumed to be an autoimmune disease. And you start to peel back the layers and you see that all these levers have been pushed. In her case, trauma. In her case, she ate pretty well, but there was a way to optimize her diet so that it could really support an intact gut barrier.
Yeah, I actually would love for you to get even a bit more granular around some examples of what you changed with her food, because you mentioned all of those pillars that you worked on in the meantime and what a difference they made. So, what were some of those food changes?
There have been studies going back decades showing that an elimination diet, well designed, where you do it for 30 days up to 90 days, and then you add the food back, you do elimination provocation, can hugely help rheumatoid arthritis. And in other autoimmune diseases in which it's been studied, elimination diet has been very effective. So I talk about elimination diet in my book. It's kind of the first treatment chapter. And so what is an elimination diet? So when you've got autoimmune disease, your immune system is overreacting to certain proteins. And so the ones that are the most reactive tend to be gluten, dairy, nightshades also seem to be a problem for people with autoimmune disease. If you think of the autoimmune protocol, nightshades are a big part of that. And nightshades are a little bit trickier. Those are potatoes, tomatoes, eggplant, they're in almost everything, peppers. So eliminating nightshades, not for the rest of your life, but for a period of time to let your immune system cool off. And then you bring them back very slowly, sort of one thing at a time. You don't go from an elimination diet for 30 days to eating pizza, which has gluten and dairy and tomatoes. You do things one at a time to then see what you react to. So elimination diet is what I recommend.
I find that sometimes people struggle with elimination diets because they feel so much better while they're on it, and they end up kind of just getting stuck there forever.
Yes. I think of it as orthorexia,
Yeah.
right? Kind of this obsession with healthy eating, which is also not healthy. This is where I always screen my folks for disordered eating, which is something that I've recovered from. So I have a lot of sensitivity to this. And I think it's valuable to walk people very slowly and methodically through the provocation part. And you can't skip it. So yes, I've got lots of those patients who are eating, like 7 foods, and they're like, I'm good. I'm so much better. I'm just going to stick with my 7 foods. And I'm like, no, you really need 25 to 35 different species of fruits and vegetables every week to feed your microbiome and to create the most diversity and, sort of benevolence in your gut.
So when you talk about the provocation process, you're saying that your goal with folks doing an elimination diet is sort of purely to tamp down the gut inflammation and the immune overactivation so that the body can just get into a better place, and B, to be a discovery process where they can understand what foods they might be especially sensitive to. Does that mean that they have to cut out those foods forever?
No. So what you do, you're trying to tonify the immune system. For people who've got really severe autoimmune disease, I tend to put them on an elimination diet that's longer, typically 6 weeks to 3 months. And so those folks, I take them through a protocol for adding foods back, and it's really slow. Like we might start with cooked tomatoes and observe what happens for 4 days. Then we might add back raw tomatoes and observe what happens for 4 days. Then we might add back sheep dairy and see what happens for 4 days. So there's a very slow process. But what I find is that for most people, as long as they're doing all of these different pieces to address the root causes, often they're able to add these foods back. It's not sort of a death sentence where you're really limited with your foods going forward. It's just a short-term way of collecting information, as you said, kind of diagnosing.
It's just helpful to have that example to understand even that 4-day period where you're observing 4 symptoms. And if someone were to, let's say, reintroduce cooked tomatoes and within those 4 days they have a bit of a flare again, would you just have them avoid the tomatoes for another 6 weeks and try again?
Yes.
Okay. I love that, because the goal of a healthy body is to be able to tolerate the maximum amount of foods. And sometimes you just have to walk the body back there when it's been in such a reactive state for so long.
That's right. When you're dysregulated, you can't use a sledgehammer to fix it. You've got to do these gentle nudgings and also listen to the cues of the body. It has to be a conversation.
Mm-hmm.
So I think you get that with the provocation process.
Yeah.
And it's free. I mean, that's the part that's so amazing. Like, there's no cost to this.
Often the current popularization of functional medicine because it's becoming a bigger industry and because more people are getting involved and it's more popular, there's almost this allopathic form of functional medicine that has now been created, where it's just like a lot of expensive testing, a lot of expensive supplements. So I wanted to ask you, also in the lens of the fact that you talk about such novel and almost provocative treatments for trauma and the nervous system within your book, I wanted to ask if you could talk us through a bit of the conventional medical treatment of autoimmunity, then the functional medicine treatment of autoimmunity, and what both of those are still missing.
So the conventional approach to autoimmune disease is typically to suppress the immune system. Occasionally, you'll go to someone who talks to you about food, who's an allopathic clinician, but for the most part, you get told, we give steroids. Steroids are kind of like, if you think about the trauma as a trigger for autoimmune disease, steroids are kind of like bathing in a massive amount of stress. So the cortisone that's in steroids or prednisone, it's a stress hormone. So that helps to basically turn off the immune system so that you don't attack your self-tissues anymore. But as you can imagine, the long-term consequences are a problem. It can lead to bone loss. It can lead to fat gain. It can lead to this Cushingoid syndrome where your face gets rounder and you've got stretch marks throughout your body. So that's not a great solution. That's kind of the one that I grew up with. There's lots of other immune modulators, kind of depending on the autoimmune disease. So with multiple sclerosis, as an example, I've got lots of patients who take biologics for that. I've got a lot of patients with inflammatory bowel disease, Crohn's disease, and ulcerative colitis who get treated with steroids or with some other biological treatment. So what's missing is root cause analysis. It's basically just suppressing symptoms, and it's using, once again, what I think of as a sledgehammer, when the body often needs this more nuanced approach. So I take your point about, kind of the rise of functional medicine as an industry. The idea of functional medicine, the way that I first learned it 30 years ago from Jeff Bland, is that it's a systems-based approach to healthcare. It's a way of thinking about these 7 systems of the body, of which the immune system is just one of 7, and you're working to create a sense of homeostasis and balance among these 7 systems that make up the matrix of your body. And you're also bringing in mind, body, spirit. Now, what's happened, I think, as more allopathic clinicians have become functional is that they kind of take that allopathic knee-jerk response to grab a medicine and they shift it to a knee-jerk response to choose the supplement that's then going to fix the problem. And I don't like that as a fundamental approach. So yes, there's a lot of expensive testing, some of which I think is valuable, some of which is not, some of which we don't know what to do with. Like I would say, we're still at the learning to crawl stage with the microbiome testing. We're still at a point where, yes, we know that there are certain bacteria that are associated with autoimmune disease. There's dysbiosis, there's loss of diversity. There's certain things that are associated with autoimmune disease, but how we most effectively treat that, we're still in the early stages. So I think the problem here with functional medicine is that it's not accessible by a lot of people because of the cost of it. There's more of a root cause analysis, but a lot of testing, some of which may or may not be helpful. The mind, body, spirit aspect, not everyone who gets functional medicine certified is great at that. I don't think trauma is enough of the conversation and story. And then, what I hear from so many of my patients is that, I went to this functional medicine doctor. He gave me a bag of 25 supplements. I don't even know what they're for. I've been taking them, but I fell off because I don't understand why I'm taking them. And maybe there's some good things in there, but I'm not a fan of taking a bag of 20 supplements.
It becomes less individualized and human relationship focused when you just are like, well, this supplement helps for this autoimmune disease, period.
That's right.
I think that that's where the missing piece is, and that's why I'm so delighted that your book goes so much into the trauma and the nervous system piece for me, because when I think about someone whose immune system is too activated to even take a B vitamin, I think about how the way to get them into a calmer immune state where they can start to titrate Bs is to calm their nervous system
Yes.
and regulate them.
Yes.
So can you say a little bit more about this powerful phrase you have in your book, which is that autoimmunity may be the ultimate expression of trauma? How does trauma and the nervous system or the overactivation of the nervous system engage with that overactivation of the immune system? And what is the path forward for our nervous system health?
So, what happens with trauma is not so much the details of what happened, it's more the way that it lives on in your body, the signature of the trauma. So, the signature of the trauma we can pick up as dysregulation. What I've found is that as someone who practices precision medicine, and I really go deep in terms of phenotyping each individual client, there are some people who just have a really vulnerable immune system. Their gut is just really vulnerable. They get symptoms whenever their stress level starts to increase, and you can detect it in their immune system. If we just imagine someone who's got a toxic stress experience, say you have a huge fight with your partner and you become somewhat estranged, you don't talk for a week. For most people, especially those of us who are sensitive, that raises the entire pathway that produces cortisol. So corticotropin releasing hormone, CRH, becomes elevated in the brain. That then makes you release more ACTH, which then stimulates the adrenals to make more cortisol. The CRH pokes holes directly into your gut lining. And so then you've got this increased permeability in the gut as a result of this fight. Your immune system is on alert and starting to get activated by these molecules that are passing through the gut wall. And that can then trigger this sort of overactivation, maybe temporary, or it may live on. So those of us who've got significant trauma, especially ongoing trauma, or there's a way that it keeps living on in the body, that's an example of how the immune system can become dysregulated. And there's other systems too. I mean, your vagus nerve is a big part of this. Your endocrine system is a big part of it. Some people, as a result of that fight with their partner, they've got increased cortisol. That might be, 2 days or even an hour. And then there's other people like me who sink their teeth into it, and it just sort of lasts for weeks, maybe months, even after you might resolve the conflict. So this is very personalized and individualized, but we can detect some of these signals, right? We can measure your cortisol level. We can look at your cortisol 5 times during the day. We can do a cortisol awakening response. And we know that people with autoimmune disease have dysregulated cortisol. They tend to have low cortisol. We know that that triggers the immune system more than any other pattern that you can see with cortisol. We can measure the problem with the vagus nerve. We can look at the sympathetic nervous system, fight, flight, freeze, fawn, versus the parasympathetic, which I think of more as stay and play. We can measure that as heart rate variability. So I use an aura to measure that every day, to look at it at night, to look at my composite daytime stress during the day. And these wearables and laboratory tests can be really helpful to assess your level of dysregulation.
And so essentially, once you have that baseline level of dysregulation, you can start to try these different techniques that you talk about in your book and see what actually moves the needle for you and what becomes your tool.
That's the magic, Olivia, because allopathic medicine is medicine for the average. It's based on randomized trials for the most part. It's based on observational studies looking at populations. It's not looking at you, Olivia, and what's going to be the most effective thing for you. And so that ends up being an invitation for us individually to do N of 1 experiments and to figure out, okay, if we measure your heart rate variability, what are going to be the top 3 things that really enhance your heart rate variability and get it to be at a level where you just feel like, oh, I'm in such alignment. I feel so good in my body, and I feel like my immune system is stable and it's not getting triggered and my mast cells are happy, like all the things. But often it takes doing these N of 1 experiments to figure out what's going to work the best for you.
I just keep thinking about the role of relationship in healing the nervous system and finding regulation.
Huge.
I think about the role of relationship with ourselves, like how much building maybe a relationship with ourselves for the first time, no matter what age you are, is crucial for moving forward, because I think about the way that I've experienced stress in my life and how much of that stress has just come from how I've spoken to myself and how I haven't had that baseline level of like respect and relationship of like, hey, I'm here with you. I'm not going to, beat you up. It was very internal for me. And I think a lot of women experience that. We can be very hard on ourselves and we can internalize the voice of our mothers and all of these things. But I also think of relationship in terms of a relationship with a practitioner and how crucial that is to heal with autoimmune disease, because only in that container, one-on-one with someone who deeply sees and witnesses you and can recognize your patterns because they've seen it with 100 other clients, can they kind of help you with the shortcuts to finding the tools that work for you. When you have the right practitioner who witnesses you and can see the way that you're starting to spiral and the type of person that you are and what you might respond to, they can hold you and they can say, hey, let's do this exercise together. Let me walk you through this for a second. Let's visualize this. And if that works for you, you can then take that tool and use it yourself. But sometimes you can only discover it through relationship and through someone modeling it for you.
You've hit upon something that I want to make explicit, which is there's two halves to the autonomic nervous system. There's the sympathetic kind of on button, fight, flight, freeze, fawn. Women tend to do the freeze and fawn more than men. And then there's the stay and play half of the autonomic nervous system, the parasympathetic. And so when you're healing, especially your pine network, but all aspects of healing, yes, you have to have that self-love.
Mm-hmm.
And it can't be like a drill sergeant, because a drill sergeant is the sympathetic nervous system. And it can't be the kind of thing where you go see your clinician and you're so defended and you're like, no, but I want that lab test. I don't understand why you want, like, that's sympathetic nervous system. Yeah. The healing happens in the parasympathetic nervous system. That's where the healing occurs. You can't do it in the sympathetic nervous system.
And you often can't do it alone because we're social creatures. And so we co-regulate with one another. And so to be in relationship, whether it's a practitioner, which I hope that it is, my goal with this season is to platform practitioners who I would feel comfortable sending my community to. But whether it's with a practitioner or whether it's with a mentor or a friend or someone who has a regulated nervous system and has done their work and has kind of found what works for them and can be with you a bit in the ship and help you to pick up on that regulation, we need other people to heal. And I think going back to the root causes of autoimmune disease and the trauma piece, I do feel that our current state of disconnection is a big part of that.
I agree. And you just modeled something really important, which is you have a way of talking from the parasympathetic nervous system, and you have a way of describing what it feels like. You talk about the self-compassion, and I think so many people spend their lives talking to themselves the way that they heard like a critical parent talking to them, which is a bit of a drill sergeant, like, why haven't you cleaned up your room? Why haven't you eaten your broccoli? And so shifting that, really understanding that that's happening, can make a big difference. It can be hard to find some of these practitioners, but they certainly exist. The other thing that you model is deep presence. And I think that's another requirement of a collaborative clinician who's going to take you by the hand and guide you through this process. So I feel like you model so many of the things that we're talking about that are needed to heal from some of these conditions related to the Pine Network.
Thank you very much. My greatest wish for the folks listening is that they find someone who they can be in relationship with and see as a practitioner or a friend or a mentor that can model those things for them, especially the deep presence. I think sometimes half of healing is just being seen. So many of us were not seen in our childhoods, or were seen for our accomplishments or our achievements in this sort of codependent relationship of, I love you for what you can do for me or how you make me feel and look. And not being seen comes in many different forms. So just to have someone be able to witness you is half the battle. And then you are able to start to witness yourself and even see yourself from their lens or from their higher vision of you and what you can accomplish in your healing. So we need each other for sure. And of course, we need these tools that we can continue to take with us and utilize in our own time and our own routines and practices. So I'm wondering if you can just walk us through some of these techniques. You talk about holotropic breath work. You talk about orgasmic meditation, which I've never tried. You talk about MDMA-assisted therapy. There's so many different ways through nervous system dysfunction that you share.
What I encourage people to do is to come up with a menu of the things that work the most for them. And maybe it's from, tracking your heart rate variability and seeing what really helps you. So we're talking about healing states of consciousness and how those map to transformation, how they map to healing the immune system, our psychology, the nervous system, the endocrine system. So there's so many ways to get to healing states of consciousness, and what works for me may not be exactly the list that works for you. So I started doing holotropic breath work about 3-4 years ago, and I found that to be extraordinary, that it has these psychedelic qualities that I really love. But I've been practicing breath work and meditation for 50 plus years, and transcendental meditation was really helpful for me. So find the thing that works for you. And then orgasmic meditation is something I learned about 15 years ago. It's what you might imagine. It's stroking the clitoris for 13 minutes. It's a partnered activity. We study it at Thomas Jefferson University, and it's got all of these beneficial trauma effects and brain effects. So it's a really fascinating practice, something to consider. Orgasm in general is something that is such a healing reset for the nervous system and for the vagus nerve. I talk a lot about immunomodulators in the book, and so I think those are important to pay attention to as well. And one of the things that I found that can act as an immunomodulator is psychedelic-assisted therapy. So MDMA is not the only thing I talk about in the book, although I think that's most proven when it comes to trauma and post-traumatic stress disorder. But ketamine, psilocybin, other plant medicines also have been shown to be helpful.
I know you also mentioned cannabis in your book when you had the section about psychedelic-assisted therapy, and you had a little caveat there where you said it's not technically a psychedelic, let's say, but it is, from my knowledge, an entheogen in a way. It can alter a state of consciousness. And I think in my personal experience, I was self-medicating with cannabis for many years because I had an inclination that it was helping me get into a certain healing state of consciousness.
Yes.
I love the way that you put that, but my relationship with it wasn't quite right. It was a bit more codependent than it was healing for a certain period of time and purpose. And so I've had more success with some of the other therapies that you mentioned, like psilocybin. But I think that there's such an importance, again, on that phrasing, that healing state of consciousness, that it's revolutionary to think that one can support themselves in the face of autoimmune disease by simply getting into a healing state of consciousness more frequently. And that there are so many doors in which we can walk through to get there. And I'm so happy psychedelic assisted therapy is becoming more and more common, and that people are utilizing these tools to get into that state of really just being human. It's almost like getting our humanness back, getting the normal brain patterns of noticing and looking at a green leaf and appreciating it and being present with it. That's really what that healing state is and what we need as humans going forward in the state of chronic illness. But I've also noticed for me, something interesting is that art gets me into that state of healing consciousness.
Yeah.
I relied on mushrooms pretty heavily for a while there, and then I started making art for like 8 hours at a time. And after I would finish making art, I would look around and I would be like, oh my God, I feel like I'm on mushrooms. I'm appreciating the grass. I'm seeing the tree for what it is and not comparing that tree to another tree like my ego would.
Mm-hmm.
And I hope that that's an area that we as a society begin to explore more. It's something that I actually want to do next in my career. I'm still going to podcast, but I'm going to go back into learning mode. And I hope to create a protocol myself for art therapy that helps people recreate and regain their relationship with their inner child.
Yeah, that's beautiful.
That's my goal.
It's so beautiful. So I want to highlight a couple things that she just said. I want to credit first, there's an incredible internist, Brad Jacobs, who first coined this phrase, healing states of consciousness. I want to give him a shout out. He's someone that I was an intern with 30 years ago, and we both do psychedelic medicine and offer that to our clients. And he's the one who's really helped me in a lot of my thinking about this. And, Just as I want our listeners and viewers to come up with a menu of things that help them get into these healing states of consciousness, I love that you mentioned creativity because creativity and flow is a healing state of consciousness. It's where you're in your parasympathetic nervous system, you're sending all the right signals to your gut and to your brain. It's just like, it's so much better than going to the club. Like it is going to the I don't know, it's going to like the best club that your body ever went to. And similarly, you don't have to take psilocybin, you don't have to take ayahuasca. You could be in nature.
Yeah.
Like nature does this for a lot of people too. I just went to Japan and 67% of the landmass is covered by forest.
Oh.
Like that's where forest bathing was first studied. And their reverence for nature, their reverence for stillness is just impeccable. And as someone who's highly sensitive, oh my gosh, Japan is the best place ever because people don't honk at intersections. There's like this respect and reverence for each other that is really hard to find elsewhere. So the menu is long. There's lots of different things that are on the menu and there's lots of ways in. And I love that you also mentioned cannabis because yes, cannabis can help you with the endocannabinoid system and how that maps to inflammation in the body. But I think there's a way that our culture is still learning how to use it. And I think I appreciated your vulnerability talking about that because, you can use it in a more sacred, reverent way. And I think that's what works better for the body and for creating healing states of consciousness.
Certainly. Respecting any plant, the power of any psychedelic plant or simple kitchen herb, they all need and deserve the respect and the relationship. So it's like relationship is what's missing. And I mean, it's 2024 and we have a doctor prescribing art for autoimmune disease. What a time to be alive. And creativity. It's just even singing for an hour. These are ways of being human that we've lost. And it's no wonder we've also lost that tolerance of what is my human body doing? What am I reacting to? What am I allergic to? I think it's all related in a very spiritual way. And I often think that my own autoimmune / histamine immune proclivities are related to the way that I honk at intersections, to your point about Japan. And I think that state is directly reflective of the state that my immune system is often in overdrive. And so it's just so nice to hear from someone so intelligent and accomplished as yourself that calming the nervous system really is a scientifically proven way forward through autoimmune disease. And it is the way that we can all access.
It's the way forward. And I would even take it one step further. I would say it's non-negotiable.
That's beautiful. So perhaps you can leave us with maybe the top 3 things that people can do starting today in the lens of that nervous system regulation piece, or maybe in the lens of the food piece, if they just want simple ways to get started in terms of having a healthier immune system.
I would say first, look at your food. Consider an elimination provocation diet. We've talked a lot about that. Number 2, measure your heart rate variability. There's so many ways to measure it now. So I've got a Garmin watch, I've got an Apple Watch that measures it. I like the Oura Ring. I think that's probably the most accurate. I've used a chest strap in the past. So measure your heart rate variability. And it doesn't matter so much the absolute score. What matters is your score over time and in response to some of these interventions. And then number 3, I would say, is relationship and community. So creating a feeling of absolute safety. A big part of the work for those of us with colorful childhoods is to feel safe when we are safe. And so that requires partners, it requires friends who really activate those safety pathways in the body, who want to be in healing states of consciousness with you, who support your divine work in this area. So I would say start with those 3.
Is there any way that you feel people can feel safe even when they're alone and not in relationship? Do you recommend talking to your body, saying, hey, I'm here, I'm safe, I'm with you?
Well, I've got a chapter on embodiment. The way I describe it is that I didn't realize until I started doing psychedelic-assisted medicine that I was functionally dissociated most of the time. When I encountered dysregulation or a problem, I would try to think through the fix. I was hypercognitive. And, of course, that's lauded in our culture. It gets you through medical school, it gets you through residency training, but it's not great in terms of relationship to self and relationship to other people. So I think maybe noticing if you tend to go upstairs and you tend to kind of think through problems, understanding a problem is in a different part of the brain than healing from the dysregulation of the problem. So you have to separate those two. The more that you're embodied, the more that you have that sense of self-compassion, not like a drill sergeant, but like as the most loving big sister or big brother, that can just really nourish and nurture who you are in the world and how you go about your work. I think that's critical.
I'm so happy that you said that. I had a note to ask you about embodiment, and you beautifully brought it back around. I do think in the health world, again, especially those of us who are chronically ill, highly sensitive, we spend so much time seeking information and thinking about our illness, what we can do, steps forward, understanding the mechanism of what's happening to us. And then we don't necessarily take the action because we're not comfortable being in our bodies and spending the time with ourselves. We know, I should probably take a bath and get off my phone and sing and talk to myself or do a meditation or call a friend or whatever it is. We know that there are certain things we should do, but we spend so much time upstairs, to your point, in the mind, thinking, knowing, learning, and not just being. And it's the being that often will feel very unsafe to those of us who've had a history of trauma. But that's where we're being called for the healing.
It's such an important pivot. And I would also say that approach of like trying to think through your solution and trying to fix the problem, it is reinforced by the medical system. So both the allopathic side and also the functional medicine side, there's a way that there's like, I'm the expert, I'm going to fix you. And that bypasses this inner healer, this innate healing intelligence that we want to be activating. So I just want to kind of knit that together with your point about people who are trying so hard to understand and what's the mechanism and how do I fix this. The more that we can kind of let go a little, I mean, yes, we want a little bit of that, but not see our clinicians necessarily as fixers, but maybe see ourselves as the ones who are the most able, the most empowered, the most chosen to help us get into a state of regulation and then to bring it forward. And that's the next step, right? Kind of like what you do, Olivia, to then bring it forward and co-regulate other folks and co-regulate through your podcast and be of service in that way so that people can get a sense in their body of what this feels like.
Such a strong message that you are your own healer. You are your way forward. The power is in your body and just being with yourself and being with others. We have a lot of folks out there who are experts essentially in their own autoimmune disease or experts in their illness, but they're not necessarily experts at being human and just being, period. That's the hard part. The hard part is not reading the medical journals and learning. The people listening to this show are smart folks. But sometimes we got to get out of the brain, into the body, and just go play. And that's what we need way more than the supplement, the information, the podcast, whatever. It's like just go and jump in a stream and just splash around.
For sure. And sometimes we need both.
Yeah,
sometimes we want, a little glutamine, a little splash in the river.
Yeah, for sure.
A little holotropic breath work.
Yes.
A little cold plunge.
So agreed. It's blending the biohacking, the modern tools and nutrients and supplements that we're so lucky to have at hand, doing the testing that makes sense for us, that's financially feasible for us, finding the practitioner that's a good fit for us, having that on one side, but then also knowing that once we get all that information, it's still up to us to do the work.
Yes.
Yeah. So beautiful. Thank you so much, Sara, for being here. If you could please let everyone know about the name of your book and where we can find it.
The book is called The Autoimmune Cure. You can get it wherever books are sold. And if you want to learn more, if you want some bonus content, you can go to saragottfriedmd.com.
Beautiful. Thank you for being with us today.
Thanks, Olivia.
Wasn't that great?